17 Facts about urinary incontinence you should know. Urinary incontinence, also known as bladder leakage, affects millions of women. While it becomes more prevalent as you age, it's not a normal side effect of the aging process, and you don't have to accept its symptoms and live with it. The basics of bladder leakage. 1. Most women begin to experience symptoms in their 40s and 50s after childbearing. In some cases, however, it can start earlier, particularly for those predisposed to urinary conditions. 2. There are 3 types of urinary incontinence. Stress incontinence occurs when weakened pelvic floor muscles cause you to leak urine when you cough, sneeze, jump, or laugh. Urge incontinence typically occurs in older women when the bladder's muscles weaken or its urine-holding capacity decreases. Also called overactive bladder, this condition causes uncontrolled bladder contractions, creating an intense urge to urinate or leak. Mixed incontinence, as its name suggests, is a combination of both urge and stress incontinence. 3. A comprehensive evaluation of urinary incontinence may involve up to 5 steps. A review of your symptoms and medical history. A physical, pelvic, or urogynecological exam. An ultrasonogram to evaluate the uterus, bladder, and rectum, their position and size, and to look for any unusual anatomical characteristics of the pelvic organs. A cystoscopy, or videoscope of the bladder, to view the health of the bladder and urethral tissue. Urodynamic testing to measure nerve and muscle function, pressure in and around the bladder, flow rates, fluid capacities, and more. 4. A common misconception is that bladder leakage is a normal milestone in the aging process. There are several reasons why women experience urinary incontinence and variety of options to treat it. 5. Urinary incontinence can be caused by a bladder issue, prolapse, when a pelvic organ slips out or down from its position, a decrease in muscle tone, weakened pelvic floor support, a condition of the body's connective tissues called hypermobility. 6. 1 in 3 women over the age of 40 experience symptoms of urinary incontinence, while it affects 1 in 2 women over age 60. For women age 80 and older, it's rare not to have some type of incontinence. 7. Pelvic floor support issues can create a situation similar to pregnancy, putting pressure on surrounding organs. And as many pregnant women experience, this increased pressure in the pelvis compresses the bladder, causes pain, and increases frequency and urge to urinate, often interfering with sleep, driving, or other routine activities. 8. Multiple vaginal births can weaken pelvic floor muscles and lead to urinary incontinence. However, women who haven't given birth vaginally also can develop incontinence. Incontinence in childbirth. 9. Giving birth vaginally later in life increases the risk of developing urinary incontinence because the amount of collagen in tissues decreases, as does the ability to heal and regenerate healthy tissues. Recovery from vaginal birth for women in their 40s can be more difficult since they may already have bladder-related issues due to the effects of gravity, decreased hormones, or other medical conditions. 10. Women who give birth via C-section rarely have incontinence issues. In fact, C-section surgery can help keep bladder and vaginal muscles tight. For instance, in highly developed countries like Italy, France, and Brazil, many women routinely opt to deliver via C-section to preserve their pelvic organs. Simple changes to improve bladder and pelvic health. 11. Drinking a lot of caffeine or alcohol can worsen incontinence, since these beverages increase the need to urinate. Avoid drinking fluids after 10 p.m. if you're thirsty. Try chewing on ice chips. Limit coffee, soda, strong tea, and alcohol after 6 p.m. 12. Healthy sleep and incontinence are inversely related. Incontinence can increase due to stress, anxiety, and lack of rest, and if incontinence wakes you up frequently, you can't get a good night's sleep. See a physician who specializes in female pelvic medicine and reconstructive surgery to regain control. 13. Eating a diet rich in fresh, organic foods can improve the condition, as can limiting processed foods and those containing pesticides, dyes, antibiotics, stabilizers, preservatives, and hormones. Avoid acidic and other bladder-irritating foods. 14. Incontinence becomes more prevalent in women with higher BMI, and the condition is common in women who weigh between 170 and 220 pounds. Losing weight can significantly improve bladder leakage. In fact, studies show that losing just 10% of your body weight can improve urinary conditions by up to 60%. Options to treat the tinkle. 15. If you're not sexually active, the muscles in the vagina and pelvis will weaken and eventually shrink. Dilators can help restore the vaginal opening, and proper pelvic floor exercises can strengthen the muscles. Kegel exercises won't restore prolapsed pelvic organs, but pelvic floor muscle therapy under the direction of a trained therapist can teach you how to squeeze the correct muscles to improve symptoms and at least slow progress of the disorder. 16. There are several treatment options, including lifestyle modifications, like changing your diet, getting more sleep, and losing weight. Oral medications to stabilize the bladder. Acupuncture via a neuromodulator machine in the ankle, which sends impulses to the bladder. Botox injections, which can eliminate bladder spasms and increase urine holding capacity. Treatments take about 5 minutes and last up to 3 months. Medications that are fed into the bladder with a tube and then urinated out. An implantable bladder stimulator, an advanced option if the above treatments don't provide relief. Injectable collagen. Radiofrequency treatment. Laser vaginal rejuvenation. Computer-controlled pelvic floor muscle therapy. Surgery as a last but not least effective option. 17. It's vitally important to get the right treatment the first time. Every patient's situation is unique, and it's important that treatment is tailored to your needs, expectations, lifestyle, and age. If you have surgery to reverse incontinence and it fails, you may develop scar tissue or alter your anatomy in a way that limits your future treatment options. Surgery, when indicated, should be performed by a highly skilled, experienced surgeon who specializes in the field. Research shows that surgeons with the highest volumes have better outcomes. You shouldn't tolerate urinary incontinence or prolapse issues by wearing pads, diapers, or changing your lifestyle. As detailed above, there are a variety of options to cure, treat, or prevent the condition from getting worse and improve your quality of life. Many patients say that they didn't realize how much incontinence was affecting their lives until they treated it. The sooner you see a doctor, the more options you'll have to consider. A simple 15-minute treatment can help you get back to traveling, playing sports, and running after your kids or grandkids.